Hello, viewers. It's another day and a good time to talk about our health. This is the GGSH Health Talk podcast. My name is Dr. Emmanuel Dowu, and I am your host. Today, we want to focus on women's health, one of the very conditions that affect women as they age, and this is the uterine fibroid. And like we always do, we bring in the expert to share their views on the subject. Today, we want to understand what uterine fibroid is all about, the signs and the symptoms, what are the treatment options that are available for women. And we have with us the Midwife Lead of Ghanaian German Specialist Hospital, and she is in the person of Miss Angelina Fiancon. Miss Angelina, you are welcome.
It's my pleasure to be here.
It's a pleasure to meet you too.
All right.
So today we want to talk about uterine fibroid. And you being the expert, as a midwife, I'm sure you've come across such cases in your facility. We want to help our viewers to understand what the condition is all about, which people does it affect more, and the like. So, from the basics, when we say uterine fibroid, what exactly are we talking about?
Okay. So when we talk about uterine fibroid, we are actually talking about non-cancerous growth that tend to develop inside or around the uterus. And they tend to vary in size and in numbers.
Okay.
So you can have just one. You can have it developing in just as a one noodle, or it can be multiple. And based on its location, it's being categorized.
Okay.
So that's all about what fibroids are.
So when you talk about location, what do you mean? Can
Okay.
you explain further?
So there are four main groups of uterine fibroids. So we have the subserosa, which is located towards the outer lining of the uterus. We have the submucosa, that is the fibroid bulges towards the uterine cavity. Then we have the intramural. The fibroid develops within the muscular walls of the uterus.
Okay.
Then we have pedunculated fibroid, which hangs to the uterus by a stalk. So these are the four categories that we have.
So, as a woman, it can develop anywhere within the uterus.
Yes, so it can develop anywhere within in the uterus as a woman.
Okay. So what's the statistics like? With your experience, do we tend to have more women coming in with this kind of condition? And what are the age ranges? Is it the elderly? Is it the young or the average age? How does it look like? How is the picture like?
Okay. So surprisingly, uterine fibroid is very common. Most women do not even know they have uterine fibroid. So they come for their antenatal first scan. You do the scan and it just pops up that you have fibroid aside your baby that is growing. It's more common among women between the ages of 30 to 50 years. Women in their reproductive age. So basically.
Okay. So you mentioned sometimes you don't even know that they have it.
Yes.
Until they come to the hospital, you do some scan, then you notice it. Are there any things to look out for as a woman? Is there anything you have to look out for that may suggest that probably you may be having some of these conditions?
Okay. So as a woman, if you're experiencing prolonged heavy bleeds and you've noticed that this is unusual, it's different from how your cycle or your menstrual bleed usually used to be.
Okay.
I think it's a cause for concern for you to come to the hospital. You're experiencing pelvic pressure, pelvic pain, difficulty in urinating. You're having abdominal distension. That suggests that you might be pregnant, but you've done pregnancy test a couple of times and it's all showing negative. These are concerns.
Okay.
That is likely some of the signs and symptoms of uterine fibroid. But you have to come to the hospital for us to establish that is uterine fibroid, because other conditions may mimic this condition.
Okay. So it's always better to come to the hospital for assessment before you can know that you have fibroid or you do not have fibroid. Right.
Yes.
So is there anything that, are there risk factors, something that puts women at risk in getting some of these conditions?
Okay. So the exact cause of fibroid is not known, but there are risk factors that are that predisposes women to getting the condition. So age, I made mention that it's very common among women between the ages of 30 to 50 years old. If you've got family history, so if your mother had uterine fibroid, your sister had uterine fibroid, you had risk.
Okay.
Then it's more common among we the blacks
Okay.
than those who are obese. So these are some of the risk factors with regards to uterine fibroid.
So viewers, as the midwife said, if maybe you have a family history of fibroid, your age, right? You
Yes,
mentioned
yes,
age,
ages.
category between 30,
Yes, it's very common among this age group.
30 to 50
Yes.
years. Okay, and what else? I mean, the risk factors.
And we spoke
Obesity,
about
you said,
obesity too as well.
is there any relationship between obesity? I mean, those who are obese, do they have a higher risk? I mean, because,
So as we said, the exact cause is not known, but there's a like risk factors. So you being obese, your chances are higher than someone who is within a healthy weight range.
okay.
So
How about those who smoke? Is there also a risk factor?
so it can be alcohol, smoking, lifestyle is a risk. Your lifestyle can actually be a contributive factor to it. And even without it necessarily being linked to uterine fibroid, we as healthcare personnel will not advocate for you to be taking alcohol or smoking because it could affect your lungs, it could affect your liver, especially with the smoking, your lungs get involved, they are affected. And with alcohol, you are looking at your liver. So health-wise, we would advise you stay away from alcohol and smoking.
Okay, I think that's well noted. So, what about pregnancy? We want to look at the relationship between fibroid and pregnancy, fertility.
Okay.
Is there any link?
All right. So most cases, uterine fibroid doesn't stop a woman from getting pregnant. But in sometimes I made mention about the submucosal fibroid, the one that bulges towards the uterine cavity. For that type of fibroid, it can have an impact on a woman's ability to conceive.
Okay. So, but there are people who tend to have fibroid.
Okay.
Theirs may not be like the pedunculated one you mentioned.
Mm-hmm.
So they may have submucosal,
Mm-hmm.
right?
Yeah.
But they still have, they've conceived, they have babies or fetus. I mean, they are
Mm-hmm.
pregnant
Mm-hmm.
and they have the fibroid at the same time.
Mm-hmm.
Does it affect the baby? Does it affect the fetus?
Yes, so based on the location and the size of the fibroid, your baby can be affected. So if the fibroid is very big and is competing with your baby for space, you can have issues like intrauterine growth restriction, where your baby does not grow to the ideal weight we are looking at, because we are looking at an ideal weight if baby is 10, that's between 2.5 kilograms to 3.5 kilograms. So your baby may not be able to attain the minimum, which is the 2.5 kilograms. There could also be you can have preterm delivery where your baby comes out earlier before 37 weeks of pregnancy. And some women with fibroid would also experience recurrent pregnancy loss. So that is the effect of fibroid when you are pregnant, if you have fibroid when you are pregnant.
All right. So I just want to find out from you. I mean,
Okay.
some people say that for some women who tend to have fibroid whilst pregnant, usually when they are giving birth, the baby comes out holding the fibroid. How true is that? I mean, have you experienced that before?
No, in my years of practice, I don't think I have ever had such case before, seeing the baby coming out holding the fibroid.
Okay. So it's a lie.
It's
But is it possible?
I haven't seen some before, so I can't say I can't talk much about it.
Okay. So viewers, from the midwife, she's done several deliveries, but she hasn't seen any baby come out holding a fibroid.
Yes.
Oh, so I mean that's for us to know. In terms of management, what are the options available? And before you talk about management, I understand that fibroid may come in sizes.
Yes.
Some may have very small size, others may be large. For those with the smaller sizes, is it a cause for worry? Is there anything that can be done about it?
Okay. So most uterine fibroids are asymptomatic, and what it means is that they don't cause any issues. You don't have any symptoms, so you may not even know. Those that would cause the symptoms are the ones that, as I mentioned earlier, would give you the heavy, prolonged bleeding, the pelvic pain, difficulty in urinating, distended abdomen. So most uterine fibroids are asymptomatic.
Okay. So those without the symptoms, the signs and symptoms, are they supposed to worry about, especially those with the smaller sizes?
So once it's not causing any issue for you, your fibroid size is very small, it can stay like that over a long period of time, or as time passes, it would go through the growth sprout process that it would increase in size. But if it's small, you don't have to bother yourself. When the signs and symptoms begin to present themselves, you can come to the hospital and we'll give you the necessary care.
Okay. So now let's come to management. What are the options available for a woman who presents with fibroid?
Okay, so when it comes to the management, depending on what the woman is presenting with. So if you are presenting with pelvic pain, and at that moment, is your pain that you want us to take care of it for you? Is the pain you want us to take care of it for you? We've got pain medication that can be used to relieve your pain as at that point.
Okay.
If you are coming in with heavy bleeding, we'll do a full blood count test to also assess your HB level. So if your blood level is very low, in severe cases, you have to be given a blood transfusion. But if your anemia level is very mild, we can put you on medication like iron supplements. Yeah, so that's it. We can also do hormonal treatment for you, like the combined oral contraceptive can be used for you. And we can give medications like tranexamic acid to also help the bleeding stop. So we have a myomectomy, which is a surgical procedure where we take the fibroid out and we preserve your womb for you. So women who are looking forward to get pregnant after they've had a uterine fibroid surgery can actually get pregnant with myomectomy. Then if you have no plans of giving birth again, your fibroid is worrying you, affecting the quality of your life, and you don't want to do the myomectomy, because when you do myomectomy, there's risk that the fibroid can develop again.
Okay.
So the only way to cure your fibroid is to do the surgery called hysterectomy, where we take your womb out. As you said, every woman that has got a uterus is at risk of having uterine fibroid. So once we take your womb out, there's no way your fibroid is going to ever develop again.
Okay. So as a woman, what can I do, or what can women do to minimize their risk of getting fibroid?
Okay. So healthy lifestyle
Okay.
is one of the things we would recommend. So if you are someone who is obese, we would encourage you to exercise. If there's a need for you to see a dietitian, let him or her help you with your diet plan. If you've got family history, from time to time, you can opt for a routine pelvic scan just to check if there's any fibroid there. So this one of this are some of
So
the
you
things.
talk about healthy eating.
Yes.
So vegetables and fruits.
So
I mean,
vegetables and
okay.
fruits, you drink a lot of water to
Okay.
stay hydrated. get enough rest,
and also exercise.
and then also exercise.
What would be your advice to those who smoke and taking alcohol?
Okay, so I would encourage everyone who is smoking or taking alcohol. I know it's very difficult to stop smoking or taking alcohol, but for your health's sake, if you can, please avoid smoking or taking alcohol.
All right. So, I mean, you've said a lot. And since you are in GGSH, Ghanaian German Specialist Hospital, right?
Yes.
What has the hospital got to offer? Is there any special package for when it comes to uterine fibroid and the likes?
So GGSH has got a very beautiful package for those who be coming in for the uterine fibroid screening. So registration is free, consultation is free, scan is also free as well. And with respect to the surgery, you have 40% discount.
Oh, okay.
We have another plan that I don't think is common when you visit hospitals. We've got the Care Now, Pay Later policy, which allows you to access quality health care and you pay later on. So you get a payment plan drawn for you according to your financial strength.
Okay.
Yes.
I think that is impressive.
Yes.
But how long is there? Is it a promo and how long is it take? Is it up to the end of the year or next year?
Okay. So this this promotion would last 30th of December. So
This year,
30th December 2025,
2025.
yes, the promotion would have ended.
Oh, okay. Okay. I think viewers, we can take advantage of this promo. I mean, free consultation, free ultrasound scan,
Free
free
registration,
registration,
40%
40% discount on what?
on
On
surgery,
surgery,
yes.
myomectomy, 40%
So whether
discount,
myomectomy or hysterectomy, 40%
40%
discount
discount.
on it, yes.
Wow. I think we should all take advantage of this. If you have, like the midwife said, sometimes you don't even know whether you have the condition. So why don't you make it a point, come to the hospital, let the doctors, midwives assess you, take your scan. If you have it, I mean, there is a treatment plan, there is a package for you. If you don't have it, I mean, it's good news. So viewers, let's take advantage of this promo. So where can we locate Ghanaian German Specialist Hospital?
Okay, so we are located at Macedonia, close to the Watch Out Estate.
Okay.
Yes.
So right from Sapema, when you get to Sapema,
So when
right?
you get to Sapeman, you'd have to continue your journey to Macedonia. When you get to Macedonia Junction, you'd get taxi. There's a taxi station right there. You've got a motor station right there. Just tell them that you are coming to Ghanaian German Specialist Hospital, and they'll just bring you to the hospital.
All right. Okay. So thank you very much for having your time with us. I mean, it has been an exciting moment. We've learned a lot.
Okay.
Personally, I've learned a lot. I'm sure our viewers as well they've also learned a lot. But before we wrap up, maybe your final words to our viewers.
Okay. So as we are wrapping up, just a little thing for us to remember. If you don't remember anything, one thing I would be ending with is every woman is at the risk of uterine fibroid, and you may not show any sign. So, as our host said, take advantage of the fact that GGSH is having a promotion around this period and get screened for uterine fibroid. And whatever your situation is, know that there are treatment plans that will be tailored towards your needs. We have also got our gynecologist obstetrician in-house who comes every Fridays at 12 p.m. So it's been nice being on this show.
Thank you very much. We appreciate you coming.
It's my pleasure.
All right. So viewers, thank you very much for making a time to watch this podcast. I believe we've all learned a lot. One thing I've learned is the signs and symptoms may not be obvious for every lady. And so it's very important to visit the hospital, do your routine checkup, and let us diagnose whether you have or you do not have. And once the needful is done, you'll be taken through a treatment plan, or there's going to be a plan for you. So, viewers, it's been a wonderful day and a wonderful time with our midwife. Learning about uterine fibroid. This has been the GGSH Health Talk podcast, and we hope to see you again in our next episode. Thank you very much and stay healthy. Bye.